Here's an example of a fat suppression problem. So this is a hand and wrist, which is a problem anyway because we're covering a long area of anatomy when we might be looking at these very tiny structures in the wrist. Ideally, it would be nice to be able to break up wrists and hands separately, depending on the indication. But given that that is difficult sometimes, it is appropriate to at times include the entire hand on a study. However, this field of view should not apply to the axial images, which is much smaller. And yet, if you look here, most of our space is just air. Our field of view really should be much closer to the size of the wrist to allow us to evaluate these tiny structures better. In terms of fat suppression, you can notice this higher signal in the subcu fat and also in the bone marrow in the fingers. And you can see it here on the axial images as well. And the question becomes, is that pathologic? We're a lot of times looking at marrow to look for inflammatory changes or post-traumatic changes. And when we see this, it makes it very difficult to evaluate. So this early on, I think this should have been recognized as bad fat suppression and switched to a stir. And then imaged this in stir as well. But instead we have three planes of this poor fat suppression, frequency selective fat suppression, and therefore we have limited information about the bone marrow. We have T1, but that's not nearly as sensitive as the fat suppressed fluid sensitive sequences.